the slide. CT module. Where is it now? Module 4. Okay. Okay, we are now in, can you see the slide? Okay, we are now in Module 4, and Module 4 is about emergency, trauma, and injuries. Let us first define what is first aid. Okay, so what is first aid? This is an emergency or an immediate care provided to an ill person or injured person before the emergency team arrives. Okay, so that is the definition of first aid. So again, first aid is giving an immediate care or providing an immediate care to an injured person before the emergency team arrives or before the ambulance arrives. The aims of first aid. What are the aims of first aid? The first one is preserving life. You preserve the life of a person, then you stop the person from dying. Preventing illness or injury, you're preventing the injury to become worse or becoming worse. Then you have to stop the person to become injured even more. Now next is alleviate pain. Alleviate pain or relieving from pain. And the next aim of first aid is promoting recovery. This is trying to help the person heal their injuries and protect the unconscious or care for the unconscious person before the ambulance arrives or before the medical team arrives. There are types of allergies. First is food allergy. So food allergy is very common. We have dust allergy, or we have pet allergy, we have skin allergy, insect allergy. Sometimes when we are bitten by insects, mosquitoes, even ants, then it starts to have rashes all over our body, or there will be itchiness on our skin. And we have latex allergy when we try to use latex gloves made by latex materials. Then we have allergic rhinitis and seasonal allergy. Guys, can you please mute your audio? Then what are the signs and symptoms of allergies? First is itching or tingling in the mouth. So if you ate a food that is allergic to you, then it starts to have itchiness around the mouth. We have itchiness or hives or rashes. We have swelling on the lips, face, tongue, and any parts of the body. We have wishing sounds. So you'd suddenly have these symptoms of congestion, nasal congestion, wishing sounds because the airways are narrow. And we have also trouble in breathing. Abdominal pain. There is diarrhea, nausea and vomiting, dizziness, lightheadedness, and fainting. So those are the common signs and symptoms of allergies. We can manage an allergic reaction in these following steps. First, we have to identify the allergens. So that is the first step that you're going to do. Identify the allergen. So what is the allergen? Is it from food? Is it from latex gloves? Is it from medication? Okay. Is it from dust? So identify first the allergens. Next, prompt accurate and early diagnosis. Okay, so now you identified already the kind of allergens. Then you have to say that I am now allergic with this food. I am allergic with the dust. Then educate your client. Now, if you already made a diagnosis that this patient of yours is having some allergic reaction, then you have to educate your patient. What are the causes of allergies? Then keep a track record of allergy. And you must document the episode of an allergic reaction. Because each allergy has different reaction. Like food, you have tingling on the mouth, you have swelling around the mouth, sometimes you have difficulty breathing. So you have to document each episode of an allergic reaction. Next is, if you know that the kind of food is allergic, you are allergic with, then you must prevent in eating that food. If you are allergic with dust, then prevent contact with any dust. Next is the accident on the road. So this accident on the road is very common nowadays. Can be either car accident, it can be a motorcycle accident. So what you are going to do when we met an accident on the road? So first is when you're approaching an accident on the road, make sure that the scene is safe. The scene is safe for you to rescue the victim inside the wrecked car. Now, you have to make sure that the traffic is stopped and vehicles are rerouted. Okay? And you must also take note if there are spillage of fuel or gas. Because this gas or spillage of fuel will cause fire or even explosion. And put a vehicle hazard light or a triangle, warning triangle, if there is one available. So the next step that you're going to do is when there are people around you, you are not alone, get them to phone the nearest hospital or call the nearest emergency services or unit. And you must assess and treat life-threatening conditions first, like bleeding. Okay, those individuals who are no longer breathing. So you have to treat them first. Then quickly establish how many vehicles have been involved in the accident. Sometimes there are 2 vehicles or 3 vehicles that collide each other. And you have also to assess the occupants inside the vehicle. Now, your priority is to assess those occupants that are not moving, that are not talking. Those are your priorities. But those participants who are talking, those who are screaming, asking for help, crying, is not your priority. It means that those individuals are still alive. So go directly to those occupants that are quiet, that are not talking, that are not moving. Those are your priorities. Then you have to check if they are breathing. If they are unresponsive, so you have to make sure that their head is on the side-lying position to keep the airway open. Just make sure that you support their head and neck and avoid them from twisting. So do not cover their ears. Keep on talking and calmly and checking them if they are still breathing. Even though they are not talking, they are moving. If they are breathing, it means they are still alive and they can hear you. If the person is no longer breathing, you need to resuscitate. So it's very hard to, to give compression and artificial breathing inside the wrecked car. How about those occupants that are alive? Okay, they are talking, they are asking help, they are screaming. So you can entrust them to a bystander. Let's say you are not alone. There are other people around you, so you can ask help from them to entrust those occupants that are still alive. Take them out from the wrecked car, place them in a safe place, and keep them warm and check for life-threatening conditions. And you must ask the bystander to check their nearest kin. Okay, for sure they have IDs, and in their IDs, it was written those person who will contact in case of emergency. So you can call their nearest kin. Now, we must remember that the nature of the wrecked car is, if it's seriously damaged, then the occupants inside the wrecked car is also seriously injured. People thrown from horses, okay, another situation. Those who are thrown, okay, from horses, motorbikes, bicycles, they are particularly damaging their pelvis. A risk of damaging their pelvis. So if you know how to stabilize their pelvis, then you can do it. Keep monitor them for signs of shock and any fractures and any bleeding. So anyone that is trapped in the vehicle should be monitored carefully, and take note that emergency services should be notified immediately. If someone has been crushed, note the exact time when the accident happened. So it is very important to decide on how or when to release the casualty. Just make sure that you have to avoid their neck and head from twisting. Okay, because possibility there will be spinal injury, and you have to avoid also additional injuries. Do not allow anyone to smoke on at the scene, or give casualty anything to eat and drink. Following the accident, maybe later they need an operation. And we know that a patient or somebody who will be going for a surgery should have empty stomach. So they are not too allowed to eat and drink. How about motorcyclists? So this is very common now. There are so many accidents that happen anywhere, not only here in UAE, in the Philippines, okay, in our provinces, okay. Lately, I've heard some news in our province, in Ojoan, that there are accidents, motorcyclist accidents. And remember this, if they are having or using their helmet, okay, and if they are unconscious, remember, unconscious, that's the only way you can remove the helmet. But if they are conscious, never remove their helmet, because their helmet will serve as a support in their neck or in their cervical area. So never remove the helmet if the person is conscious. But if the person is unconscious, so you can remove their helmet. So let's say that the victim is conscious. So and you can observe that she has this difficulty of breathing because of the helmet. So you can just raise the visor, okay, but never remove the helmet. Then if you have a training in MILS or management and life support, or we are as especially the healthcare workers, they are requiring us to have an active BLS, basic life support, so you can help this casualty. And how about those who are being hit or thrown from one side and they lay conscious on the road? They should be encouraged to keep still and ensure that somebody is directing the traffic and maintaining safety. Just support their head and neck, avoid from twisting, and keep them warm and dry, and wait for the emergency team to arrive. Let's go to burn. Okay, burn is another common, incident that we need to have that immediate treatment. Okay, it can be a first-degree burn, second-degree burn. Okay, what is burn? Burn is characterized by a severe skin damage that causes the affected skin cells to die. So the burn is not only caused by fire. It can be a chemical, it can be a hot steam or hot surface. So there are causes of burn. It's not only caused by fire. Now there are 3 layers of our skin. So the first layer is what we call the epidermis. And epidermis is the outermost layer of the skin. This provides a waterproof barrier that creates our skin tone. So what we can see in our skin or with our eye right now is the epidermis, and that is the first layer of our skin. And the second layer of the skin is our dermis. It is beneath the epidermis. It contains tough connective tissue, hair follicles, and sweat glands. And the deeper layer of the skin is the hypodermis, and it is made up of fat and connective tissues. Now let's go to the kinds of or types of burn. Okay, the first degree burn is considered mild. The second degree burn has partial thickness, and the third degree burn, it goes deeper into our dermis. Okay, epidermis, dermis, and it goes to the deeper tissues. So what are the functions of our skin? Okay, the function of our skin is to regulate temperature, that is our body temperature, to oxonic enclosure that stops the water from entering into our body. It reduces the loss of water. It protects our body from infection. And it produces vitamin D precursors from morning sun. And it protects damage from ultraviolet light. Now, what are the major management of major burns? Okay, first is when you have major burns, let's say you protect the burnt person from further harm. Okay, so do this, and when the person is in contact with a source of burn, like electrical burn, so you have to remove the person or off the main switch. But don't remove the person if you don't know how to do it. Okay, you can't just use anything in order to remove the person. You can only use a wood because wood is non-conductor. Next is cool the burn. Okay, hold the burn area under cool, not cold, running water. Okay, so wet compress, it helps to ease the pain. Okay, and then you must remove the rings. Okay, first remove the rings or any tight items from the burned area. Because remember that the burned area will suddenly swell. So it's very hard to remove those tight items. Don't break blisters. Okay, breaking blisters is not allowed in burns because blisters will protect against infection. Just clean the area with mild water, apply an antibiotic ointment, but when rashes appears around the wound, so you have to call your physician. It means you are allergic from that antibiotic. Bandage the wound or the burn. Okay, cover the burn with a sterile gauze, not a floppy cotton. Okay, wrap it loosely. Don't put too much pressure on the burned skin. Bandaging will keep the air off, and the area reduces pain and protects blistered skin. And if there is too much pain caused by the burn, so you can take an over-the-counter drug which is analgesic or pain reliever. Let's go to the Wallis Rule of 9. Okay, so I know that in your module there is Wallis Rule of 9 where you can see the areas of the body. Okay, it's percentage. The Wallis Rule of 9 will assess the percentage of the burn area, and this helps physicians, and this will serve as guide for them to decide regarding the treatment that they have to provide to the victim. Okay, for Wallis Rule of 9, okay, the face is 9%, the neck is 1%, okay, arms is 9, the chest and back is 18, the legs is 18%, the hand is 1%, and the foot is 1%. Okay, so let's say a victim came in your facility. It's in the emergency room, and it is a burn client. Now, the doctor assesses the burn client, and upon assessment, the burn covers the face, okay, the neck, and the chest part. So, how many percent is the burn? Okay, we have 9% on the face. The neck is 1%, so 10 and 18%. Okay, so we have 28%. Now, the doctor will decide what treatment he will provide to the victim. Now, let's go to choking. Okay, what is choking? This is very common to elderly and also to children. Okay, choking is Nanika, you are still here. Okay. Okay, choking is anything that blocks the airway. It can cause by food or objects or toys. Okay, for children, remember children 5 years old and below, never let them play small toys, okay? Because, children are very, adventurous. Okay, they place anything, okay? All openings in the body. Sometimes they place it here, at the mouth, on the ear. So never let the children play with small toys, 5 years old and below. Now, any object, food, toys that blocks their airway, we call that choking. Okay, let's know first the signs of choking. The signs of choking is hand signal. Okay? Okay, that is the first. Or clutching the throat, the person cannot talk, or the person cannot speak, yes. And for a child, the child cannot cry. Okay? There are two types of choking. We have partial and full. When we say full, the whole throat was blocked. Okay, or was obstructed by an object or food. But for partial choking, it's 50% is being blocked. Okay, so when it's blocked, the airway is narrowed, so you can just hear. Okay, so there is wishing sounds. But for full choking, the whole throat was blocked or is blocked by food or any object. Now, the next step that you're going to do is go to the client. Let's say you're eating in the restaurant and the person in front of you is being choked. Go to the patient and ask, are you choking? Okay. If the person will say, yes, I'm choking, then he is not choked. He is joking because a person that is choked cannot talk. Okay? Now, go behind that person and give 5 back blows between the shoulder blades. Okay, we have the shoulder blades. Between that, give 5 back blows using the heel of your hand. So we have 5 back blows. Then you have to check the mouth of objects and food. If there is no object, you cannot see the object or food inside the mouth, then don't make a blind sweep. Because the more you place your finger, on the mouth of the victim, that object will go deeper on the throat. So never made a blind sweep. So what you're going to do is do abdominal thrust or Heimlich maneuver. Okay? So place your non-dominant hand just above the belly button. Then you have to push hard and up, okay, as if you're lifting that person. If this is a child, so you kneel. Because a child is short and you're tall, then kneel behind that child. Do this for 5, okay?
I have watched the help to me.
Okay, 5 back blows, 5 abdominal thrusts. Do this for 5 cycles. So 5 back blows, 5 abdominal thrusts is 1 cycle. So do this for 5 cycles. Now, how about for obese or pregnant? Okay? For obese and pregnant mothers, how will you do abdominal thrust? So it should be high abdominal thrust. Okay? For slim or thin individuals, it's just above your belly button. But for obese big belly, and pregnant mothers, you do high abdominal thrust. Okay? For infant, do chest thrust. Okay? Using your 2 fingers. Now, you have to check if the victim is responsive. Now, if the victim is not responsive, then you proceed to CPR. Okay? Let's go to the basic steps of CPR. First, you can see somebody fell unconsciously on the road. Then go to the victim. But before going to the victim, if you are a certified first aider, check first if the scene is safe. Now, if the scene is safe, then go to the victim. Then check responsiveness. Hey, are you okay? The person is not responsive, then call 911 or 999. Or let somebody call. Oh, you there, please call 911. Okay, while you will check, check pulsations and breathing. How will you check pulsation? Okay, in your carotid area. Then where is your carotid area? You do this signal. Okay, place it here. There's two sides here is your carotid area. Okay, then use your two fingers, feel for pulsations. Place your face near the nose and mouth of the victim so that you can feel if there is breathing. And your eyes focus on the chest and look for movement of the chest. Okay, the rise and fall of the chest, not more than 10 seconds. If you feel that it's already 6 seconds and you cannot feel anything, no pulsation, no breathing, then proceed to compression. So remember the word cup. Okay, C is for compression. When we are compressing, we do compression, we are restoring our blood circulation. So remember that when the heart stops pumping, okay, the lungs also is affected. Blood circulation stops. So you have to do compression to stimulate again the heart. So compression is restoring circulation. Do 30 compressions. Okay? Where will you place your hand? In the middle of your nipple of the victim. For adult, use 2 hands, okay? As you compress the chest part of your client or the victim. For a child, use 1 hand. For infant, use 2 fingers. Okay, now going back to checking for pulsations. For adult and child, check the carotid area for pulsation. For infant, check the brachial area. Now, after you deliver 30 compressions, the next is A. We have CUB. We must follow CUB. C is for compression. A is airway. Okay? Now, you have to do head tilt, chin lift maneuver. Tilt the head, lift the chin, close the nostrils, breathe from your mouth to the mouth of the victim. Okay? If the mouth is seriously injured and cannot be opened, so you have to breathe from your mouth to the nose of the victim. Okay. How about for infant? For infant, you don't have to hyperextend the neck because the neck of the infant is very fragile. Okay? So breathe from your mouth to the nose and mouth of an infant. Now, after giving 2 blows, okay, remember 30 compressions and 2 blows. Do this for 5 cycles. 30 compressions, 2 blows is 1 cycle. So do this for 5 cycles. After the 5th cycle, then go back to check responsiveness. Okay, check again pulsations and breathing. Now, if the person or the victim has signs of life. So, what are the signs of life? We have the person is breathing, the person has pulsation. For infant, there is movement. Okay? Those are signs of life. Then you have to roll the person or the victim in a recovery position. So what is recovery position? Let's say the rescuer is on the left, okay? Then the left hand should be placed away, okay, from the body of the victim. Then one hand, place it on the face. Then you have to roll the patient towards the left. Roll this in order to maintain the airway open and wait for the emergency ambulance to arrive. Okay, guys, I have 5 minutes break for this lecture. Okay. Yeah, I have to. Okay, thank you guys for. And in YouTube, yeah, there is one watching. Yeah, I know that those who missed the module 4, guys, you can access my live streaming, or you can also go to YouTube, in my YouTube channel, so you can follow the sequence of our lesson. Okay, so we have to wait for 5 minutes before the Zoom again will resume our session. With me are my friends here. Thank you, guys. Okay. Yeah, all my cell phone are busy right now. I have my live streaming in YouTube, and at the same time I have my live streaming in FB. Okay, and I have one more. Okay. Yeah, because there are students who are absent, especially this season of Ramadan, and I have to do this, to do live streaming so that they can access my lectures if ever they are not they have not attended the lesson for today, either face-to-face or online class, okay? So I do this live streaming. Yeah. Hi guys, so I have also students watching in my YouTube channel, and some of my friends watching in FB. Okay, thank you very much, guys. Okay, it will take, let me check, it will take 2 minutes more before the Zoom will resume our session. Yeah, it's already the at the end of the week, and yes, tomorrow is my off day. It's my rest day tomorrow, so probably I'll be home, and yes, whoever is there, yeah, thank you for joining me. Okay. Now again, those students who, especially Superflexi students, you have no privilege to listen to my lecture in the classroom because you're Superflexi, either online. So please don't hesitate to go to my channel, and don't pass this opportunity for you guys to watch in my live streaming, because you will be benefited of this live streaming session. Okay, let's check again. 1 minute more. So the Zoom is cutting my time, and I prefer not to upgrade in my Zoom account because I also want, to rest my voice. Okay, so Yeah, can you please wait for 1 minute? Okay, guys. Later after the class, I can reply to your messages. I cannot, go to Messenger right now because I'm on live streaming. Yeah, later I will reply. Yeah. Hello, Lodimar. Hello, Pinsan. Kamusta? Okay, let us check. Yeah. Okay, it's now connecting. Oh, where is it now? Okay, guys. I'm good. Congratulations. You have finished the course. Yeah, good to know. Please join. Oh, yeah, the OJT. Did you call the center? Did you call the center? Please call the center so that you will know the details, okay? Okay, good. Okay, guys. 412 Sophia, Jezebel, Renato is here. Okay. Oh, did you enroll PTT? Did you enroll? Marilyn. Okay, let me share. Oh, really? Yeah, because your name in YouTube, maybe it's a screen name. That's why I cannot identify you. That's good. Okay, so when there are signs of life, then you roll your patient to the recovery position and wait for the emergency team to arrive. Okay, we have what we call EMS, Emergency Medical Services, and they have their AED. Okay, that is a small machine used during resuscitation or during CPR. Okay, we call that automated external defibrillator. Now, the next topic is, let me check. Maybe this is the last. We have suffocation. Okay. So what is suffocation? Again, guys, please mute your audio. Yeah. But you need OJT. Okay, just visit the center so that you will know all the details. Okay, all the details in your on-job training. Okay. Now let's go to suffocation. What is suffocation? This is preventing the access of air to come inside the lungs due to chemical or physical hazard. How to remove an attack of suffocation? So it is very necessary to have few shallow breaths and exhalation. Then you hold your breath. This manipulates or saturates the blood with carbon dioxide. And the concentration of carbon dioxide will be elevated, and that's a result to the relaxation of our bronchi, and that restores breathing. Now, next is you can try to breathe out all the air inside the lungs, especially if you have breathed or sniffed and hot smoke. Okay, you draw the air with small and short breathing, and breathing gradually normalizes. Another way to relieve suffocation is with the palm of your hand, you have to push the patient heavily on the chest during exhalation. Okay? And you do this 10 times, and this dramatically reduces the attack of suffocation. And the next, another way to relieve from suffocation is using an inhaler. Okay, and this is vasodilating drug. Is a vasodilating drug will dilate your airway. Okay, so when this dilates, then you will breathe adequately. But don't overuse the drugs because there will be side effects like rapid heartbeat or tachycardia. You have weakness and headache. And if this suffocation is caused by an allergic reaction, okay, allergic reaction is the airways are being narrowed. Okay, and when the airways are narrowed, so the person will have difficulty breathing. So you need to take an antihistamine drug, or it can be an inhaler as well. Okay, so that you will be relieved from difficulty of breathing. Now, if you are involuntary witness of an asthma attack, and this is caused by suffocation, you must do the following. Okay, call immediately an ambulance and calmly and clearly instruct the dispatcher from the ambulance. Tell the ambulance about the information of the patients, the condition, and the main symptoms of the attack. If the patient is conscious, then calm him, explain to him what steps you have taken to help him. Create conditions of fresh air or environment. So if that is a man, then probably a man is using necktie, the shirt is tight. So you have to loosen, okay? And remove excess clothing, okay? If the cause of suffocation may be a foreign body located in the larynx, try to squeeze the chest strongly, mechanically pushing it into the airways. Then it is necessary to allow the person to clear his throat. If this is the sudden attack of a person and she or he lost consciousness, so moreover there is no breath. So try to have buried heart massage and artificial respiration. If the consequence of an attack of suffocation can be a tongue sinking, so place the person on his back and his head turned to one side. If the cause of suffocation be a chronic disease, such as asthma, bronchitis, tracheitis, heart failure, then you must give the victim or the patient his medication, or it can be an inhaler. And that inhaler is a bronchodilator, and it can take the medicine first before the ambulance arrives. And if this is caused by aphasia against an allergic reaction, so you have to give the patient antihistamine drug and instruct the client to take more water or fluids to bring the allergen out of the body. Okay, so that ends our lesson this afternoon. Any question? Any question? Guys, you can unmute so I can hear you speak. Hi, Dan. Kamusta, Dan? Guys, any question, any doubt?
Hello?
Yes, Anne.
Hello?
Yes, Anne, I can hear you.
Madam,
Yes?
you will send me exams online and I do exams?
Yes, our exam is online, but you have to finish within an hour only, okay? Otherwise, this will disappear. The questions will disappear. So you have to finish the
Okay.
exam for within an hour.
Okay, madam.
Okay, you're done with all the modules.
Yes, madam, what?
Did you complete all the modules from 1 to 5?
I read, I had a topic home care and finished reading. I have topic home care and managing it.
You're done? Did you attend those discussion?
Not this, but I read.
Okay, you have to, to attend. Okay, not only reading.
Okay.
Yeah, I told you to have advanced reading, but you should attend in my class.
Okay, madam. Okay, madam. Thanks for the correction. Okay, madam.
Okay, and as soon as you finish the 5 modules, then you're ready for the exam.
Okay,
Okay?
madam. Okay, thank you so
Then
much.
you have also to complete your skills. Okay, remember, we have practical skills and you have to complete. You can come here in the center, or if you are not permitted by your employer to go out, then go to my YouTube channel. You can access all the videos there. Okay, you will be guided on how to perform. Okay, take a video of your performance, then send to my WhatsApp account. Okay?
Okay, madam.
Who else? Serenato? Who is the one speaking?
Camille, ma'am, Camille.
Yes, Camille.
Ma'am, after po this 5 module, yung exam po this day or next week po?
Okay. So just tell me, Mom, I'm ready to take the exam. Okay?
And then, ma'am, ganyan 1 hour like that, ma'am?
Yeah, you have to finish within an hour.
Okay, ma'am. Thank you so much.
Okay. Serenato, do you have a question?
No, ma'am, no.
Okay. Kamusta sa Pilipinas?
Okay lang, masyadong mainit pa rin.
Mainit? Hindi, parang umuulan. Nakikita ko sa news, umulan.
Nasa Luzon lang yata.
Luzon.
Pero dito sa-
Nasa Cebu ka pala.
Oo.
Ang layo ng mga estudyante ko. Okay, so Jezebel Briones, do you have question or any doubt?
No, ma'am. Wait, I have question, ma'am.
Is it clear? So, wait, I have to stop sharing first. Okay, let me
Ma'am,
check.
may question po. Yung exam po, dapat kukunin po sa first module to 5 modules?
Okay, 1 to 4.
1 to 4 modules?
Yes, 1 to 4.
Okay,
And this is objective, okay? 80 items.
Okay.
Who is combo here? Anyone? From caregiving to nursing assistant? Hi, sis! Sis June!
After po ng caregiver, ma'am, pwede pong
You want to
enroll
proceed? Yeah, if you want to, yes, if you want to proceed, then send me a private message, okay?
Okay, okay, ma'am. Thank you.
Okay. Guys, can you please, where is the chat box? Okay, I have another number in case because my tablet was I don't know if it is hacked or because I cannot access, I cannot open anymore. Then I send it to the shop and they erase all data or they call it reformat and everything was lost. Okay? I can access you only through WhatsApp web. Okay? In case of emergency, so you guys can reach me in this number. Ano. Okay? So 521-315. Okay. You can read?
Madam, which number?
Yeah, another number.
Madam, I have not got it.
Huh? It's in the chat
What
box.
is the... Okay, okay.
Okay. Please save my other number.
Okay, madam.
Because we don't know how long this WhatsApp web
Okay, madam.
will stay on my laptop. Because the SIM card is no longer working.
Madam, how many practicals are we supposed to do?
Practical skills, did you receive your hard copy of your module?
Yes, please.
Okay, if you receive the hard copy of your module, then you can read there. We have, okay, first is the vital signs. Okay, we have the PPE, including hand washing, personal hygiene. This is bathing the elderly. Okay, from oral care, hair shampooing, perineal care, the bed bath, changing linen is there also. And we have baby's bath for the newborn, swaddling the baby, and what else? Daily care plan. Okay? So if you, okay, thank you, Sir Renato. So if you receive the hard copy, go to the first page and you can find your assessment. Okay? Did you receive your copy? Except with Sir Renato because you are in Cebu. Again, the rest?
Madam, will you copy, madam?
Copy?
Before, madam, you send the question for assignment. Me, I did and I sent you one assignment before. You
Assignment.
gave us assignment about cognitive skills.
Uh-huh.
I send on your number.
Anne, how many months you are now in caregiving?
Madam, it's very many. Let me see.
Huh?
Oh, 4 months.
4 months? Why it takes so long, Anne? What is left with you?
Madam, I don't know when you stay in the house.
And what happened to you? What happened to your head, Anne? Why you have bandage in your head?
I get an accident.
Yo! What accident? Why this is covered with bandage? What accident?
I was in the bathroom washing
Oh.
clothes last night. Then I fall on
You
my chair.
sleep?
The door banged me.
You sleep on the floor?
Yes, the door banged me. And I
Ah,
had
your
to
head
wake up.
banged. Where? On the floor? On the wall?
Hospital. on the door, this door, like the door.
Oh,
They
so
have a
it
big
bleeds.
cut. Yes, I go to the hospital and I get 5 stitches.
And they stitch, how many stitches?
5.
5 stitches, oh my, that's a lot. Okay, I thought it's a hat or it's a bonnet. And now I look it closer and it's a bandage. Oh, you have to take care, Anne. Okay, so any concern, Anne, just send private message, okay?
Okay, mother.
Okay. So who else has any question or any doubts? Okay. Let me. Anne Renato is here.
Now my employee is calling me.
Oh.
Now I'm going to leave the class. He's calling me now.
Calling you now? Okay, you can leave. You can leave the meeting room. I know you have still
No.
work. Yeah, you can go.
Madam, no,
Huh?
no assignment.
No assignment
Madam.
as of now. No assignment.
Okay, madam. Bye. He's calling me.
Okay, yan. Okay, yan. Stay safe.
Okay, madam.
Uh-huh. Okay, guys, we have to end our session this afternoon. Thank you for joining me. Have a pleasant weekend. Okay, stay safe, guys, and God bless. God bless.
Okay,
Bye-bye.
Bye, madam.
Bye. Stay safe.
Bye.
Hello. Yeah, you're still there? Thank you for joining me the whole session of our class this afternoon. And see you again on our next session. Thank you. God bless. Thank you, Focus. Just visit the center, okay? Bye.